Hi, so I just wanted to come on today and talk about Benlysta. There still doesn't seem to be all that much information out there about it, even though it's been out for a while now. I had a really good experience with it at first because after only a couple of short weeks, I started feeling really good, like almost 100% myself again, which was amazing. Honestly, it's the first time since I really started getting sick that I felt so much better. But there's a warning on the box when you get the medication that states that it can cause suicidal depression, and it's really crazy. So I didn't think this was going to happen to me because I'm not normally depressed. Um, what I did think could happen was the anxiety. I know a lot of people talked about how it caused them like severe anxiety like, right after their injection. Like if they were doing it home injection, they would get really anxious. So that's what I thought would happen. But before I even realized I was starting to get depressed, and this was like month two and a half maybe, it was like so bad. It was terrible. I've never felt so bad in my life. I mean, it wasn't even like a progression. It was just like 0 to 100. It was really bad. So at that point, I called my rheumatologist. I discontinued the medication. I've since tried to get a prior auth for Safnilo, and that has been a nightmare. It's been months and months of like going back and forth. Now they're just saying, well, we don't really have a choice because there's not a lot of medications that they have to treat lupus, so they want me to go back on the Benlysta. And the only choice I have is to go see a psychiatrist that can prescribe some kind of medication to mitigate this side effect. Like, even though this isn't the norm for me, I can't let this happen, and I can't allow this disease to just be taking years of my life. So I really don't have a choice at this point. I mean, I am definitely excited to take it and start feeling better, but that side effect was really horrendous. I am also on Plaquenil, or you might be taking the generic hydroxychloroquine, and Cellcept. The generic for that is mycophenolate. But they're definitely not doing enough. I'm miserable most of the time. In bed, exhausted, really bad joint pain. The brain fog is just, it's too much. It's just too much. So I am going to be letting you guys know how it goes with trying to mitigate this side effect. I think that it's really important because I've heard of a lot of people having this side effect and nobody's really talking about it. I don't see anything about this on YouTube because I'm trying to see like how are other people dealing with this, and there's just nothing. So if nothing else, at least people can see how I've been trying to mitigate this side effect and if I've been able to do it successfully or not. I'm really praying that this works, but my rheumatologist also talked to me about a clinical study that's going to be starting sometime towards the end of the summer, and I'm seriously considering doing that. I'm just wondering, because I have a negative ANA, and I always have, I'm diagnosed with ANA negative lupus. I'm wondering if I start this medication during this clinical trial. Once the clinical trial is over, are they going to give me a problem getting this new lupus drug? Because the whole problem with getting this Safnilo is that my ANA is negative, which seems very discriminatory with the level of disease activity I have, but what am I going to do? I could make a whole nother video on that. I probably will. Let me know if you guys want to see that, by the way. So I don't know, I don't really see any other options. This is kind of really upsetting. like I said, I am looking forward to feeling better, and I'll keep you guys updated on how it goes. I mean, I hate to take more medication to deal with the side effects from the medication I'm taking to treat the, it just seems a little crazy. So the Benlysta comes like this. It has to stay refrigerated. It's sent to you by a specialty pharmacy, so it's all in like ice packs in a big box. It's mostly ice packs, like a tiny box of the Benlysta, and like this big box just full of ice packs. So you definitely want to make sure you know when your Benlysta delivery is coming and you get it. Especially, I live down south. If you live in an area that's hot all the time, you want to make sure you get it in the house right away and into the fridge, because medication will go bad if it's left unrefrigerated. So basically it looks like this. And there's a needle in here. So you do it in the thigh or in the upper, I think the mid abdomen, if I remember correctly. It's been a while. And then you put it in your sharps container. So I'm going to do a video on how I give myself the injections, and I'm going to try to keep you guys updated on how this all goes, because I'm hopeful, but that side effect was really bad, and it came on out of nowhere, so you just don't know when it's going to creep up on you and be really severe. Alright, well, if there's anything else you guys want me to do a video on, let me know in the comment section, and I hope this helps somebody.